Hi, Nicole. I'm Dr. Mad. I'm gonna go ahead and take a look at your abdomen.
Okay.
So I understand that you're having some discomfort.
Yeah.
All right. So is it okay with you if I open the gown?
Yes.
Okay. Okay. We're visually taking a look to see if there is any redness, asymmetry that's very obvious, and everything looks symmetric. I'm going to go ahead and listen. All right, I'll have you relax. This is going to feel a little bit cold. Abdominal sounds are a little bit hypoactive. Sometimes drinking more fluids and increasing fiber can help that. How would you describe the pain? Is it sharp or dull?
It's more moderate in the middle.
Okay. And is it constant or it comes and goes?
In the mornings, I feel it more.
Okay.
Yeah.
And on a scale of 0 to 10, how would you rate them?
5 to 6.
I'm going to go ahead and percuss. Let me know if you feel any kind of pain.
Okay. A little bit there.
Okay.
There too. Right there.
So far, normal percussion sounds. I'm going to go ahead and palpate.
Okay.
Okay, I'm going to feel your kidneys. I'm going to slide one hand behind your back. Very good, and we're going to palpate and just gently press down. Good. And same thing on the other side. Okay. I'm going to take a few measurements. So we're looking for inflammation, And there's about a 10% increase in angles on the left side. Okay, this is going to feel a little bit cold. We're just taking more measurements to see exactly the level of inflammation that you have in the abdominal area. We're going to check neurological responses, so go ahead and tell me when you don't feel the vibration anymore.
Okay, I don't feel it.
What about now?
Now I don't feel it. And now I don't. I don't feel it. Yeah, it's good. Don't feel it. Stopped. Don't feel it.
Very good. We're going to check skin turgor, which usually determines the level of hydration and nutrition. So this is just a pinching test that we use to see exactly the elasticity of the skin. And now we're looking for any abnormal skin growths. Good. Okay, I'm just going to go ahead and tap on the bony prominences of your cage rib. We're looking for any abnormal responses. Something that would indicate inflammation of the liver and main organs. very normal responses. And these. Okay. Okay. Go ahead and tell me if you feel this cold or warm.
It was cold. Very cold. Yeah, cold. Warm. That was cold. Warm. Cold. Warm. Warm. Cold. That was warm.
Go ahead and tell me if you feel this on the left or right.
My right side. My left side. Left. Left. Right. 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 Left. 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 In the middle. Middle left.
Okay. I'm going to apply some acupressure. What we're going to do today is to do an anti-inflammatory treatment. It's going to help to lower some of the inflammation that you're having in the abdominal area. We're going along the line of the medial muscles. I'm going to apply some anti-inflammatory oil. I like to use olive oil as the base. It also helps to hydrate the skin. And it stimulates blood flow. let me know if you're pressing too much.
Okay.
Okay, so we're just gonna go ahead and slowly massage the interior part of the abdominal muscles. This technique usually also helps to tackle some of the belly fat. And also to restore homeostasis. going to apply a little bit more oil. And we are going to perform cupping therapy. It also helps to destroy some of the cells that can trigger inflammation. This is going to feel a little bit cold. Okay, Nicole, I'm gonna go ahead and close your robe. And whenever you're ready, I'm gonna have you sit back on the table.
Okay.
But I would say that the treatment was definitely a success.
Thank you.
Hi, Caitlin. Hi. How are you?
I'm okay. How are you doing?
I'm good. Thanks for coming in. My name is Dr. Matt. I'm going to do your examination today. Before we go into full symptoms and what's going on with you, can you please verify your first and last name and your date of birth?
Yep. It's Kate C. ASMR, and it's March 4th, 1997.
Okay, perfect. Do you have any allergies?
I don't.
No allergies. Okay. And any relevant medical history?
No.
Any injuries in the last 12 months?
No.
Okay, so go ahead and tell me what's going on. Do you have any pain right now?
I don't know if I'd call it pain, but definitely a numbness and tingling sensation that I've noticed around my head area. When I go to put my head in a ponytail, I started to notice I can't feel the brush on my skin in certain areas of my head. my neck as well, and kind of a tenderness in my face too.
Neck, face, you said scalp, and back of the neck. Okay, any recent infections?
No.
Okay. And are you taking any medicine on a daily basis?
Yep, just birth control.
Okay. And are you experiencing any pain or just numbing?
It's a numbing feeling, kind of pins and needles. Yeah.
Have you noticed anything abnormal with your sensations anywhere else on the body?
No, it's kind of just around my head area.
Okay. Any changes with your taste?
No.
Okay. Have you noticed any abnormal smells? A smell that is not there, for example?
No, I haven't.
Okay. Any vision changes? Do you see floaters or any double vision?
No.
Okay. And what about your hearing? Have you noticed anything out of the ordinary? Any buzzing? Anything coming out of the ear, like a liquid?
No, it's all been normal.
So it's very reassuring that you don't have any extra symptoms, but I do take this very serious. So I'm going to go ahead and do a vital signs check and also do a sensation test to make sure that we're checking your reflexes. Sometimes we could be missing some of the symptoms if we don't do those tests. Okay. So today is the perfect time to do it. Is this arm okay?
Yes.
All right. Okay, I'm just going to place this here on your palm. Okay. Okay, blood pressure is within normal limits, 123/70. And I'll check your heart and your lungs too. Okay, heart sounds normal. Can you go ahead and take a deep breath in and breathe out? And again, take a deep breath in and breathe out. Take a deep breath in and breathe out. Good. And again, take a deep breath in and exhale. Okay, so lungs and heart sounds are normal. I'm going to check your pulse as well. Okay, pulse is about 60 beats per minute. 2 plus. And I'm going to compare. Very good. So they are symmetric. Okay. I'm going to do just a neurological function of your upper arms. Can you please put your arms like this in front of you? Alright, so there's no shaking, no trembling. Okay. I'm going to try to push down your arm. Don't let me do that, okay?
Okay.
Good. Good. I'm going to try to push it up. Okay. And open it. I'm going to try to open it. Don't let me do that. Okay, go ahead and relax. I'm going to ask you to shrug your shoulders. I'm going to push down, okay? Okay, good. And now can you please look that way with your head? So turn your head that way. Good. And now go ahead and turn your head this other way. Okay. Can you please close your eyes? I'm going to try to open them. Don't let me do that. Okay, go ahead and lift your eyebrows up. Lift them up, eyebrows, all the way up. Good. Go try to push them down. Don't let me do that. Okay, very good. And can you please give me a big smile? And now frown. Okay, so really frown with your eyebrows, okay? Not with your mouth. Okay. Alright, that's good. And can you please stick your tongue out? Good. And move it up and down and side to side. Good. Now go ahead and push with your tongue inside one cheek and the other one. Okay, very good. Go ahead and close your eyes and tell me with which ear you hear this sound.
Left. Right. Both.
Okay. And can you please tell me if you feel this equally on both sides? Go ahead and keep your eyes closed.
Yes. Yes. No.
Okay, and which side you felt it more than the other?
On the left.
So you felt it more over here? Okay.
Same on the left. Both. 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 Both.
Okay. I'm going to ask you to relax your jaw a little bit more. Open it. Perfect. Okay, good. You can go ahead and close. Okay, go ahead and uncross your legs for me. Okay. So there is a decreased neurological response on the right side. Okay, that was better. I'm going to check your pupil size. Can you please look right here? Okay. Go ahead and close your eyes and tell me when you don't feel this vibration anymore.
No. 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 No.
Okay. Can you please tell me if this feels cold or warm?
Cold. Warm. Cold. Cold. Warm. Cold. 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 Cold.
Okay. And does this feel sharp or dull?
Dull.
Sharp or dull?
Sharp.
Okay. Go ahead and tell me if it feels sharp or dull.
Dull. Dull. Dull. Dull. Dull. Dull. Sharp. 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 Dull. Dull. Sharp. Dull. Dull. Sharp. 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 Dull. Sharp. Sharp. Dull. Sharp. 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 Dull. Dull. Sharp.
Okay. So there is some inconsistencies with your answers. Definitely on the right side, there's some loss of sensation. You were able to distinguish the temperatures, but the pressure ones were a little bit more difficult on the right side. And is it okay if I palpate your scalp to see if we need to do a checkup there as well?
Yes.
I'm not feeling any bumps aches or anything like that. I'm going to take some measurements to see if there is any inflammation or asymmetry. So I'm looking for muscular atrophy, and that could be an indication of nerve damage. I'm noticing some asymmetry on the right side. So I'm wondering if it's a tense muscle or a pinched nerve. Okay, can you please go ahead and close your eyes and tell me if this feels sharp or dull?
Dull. Sharp. 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 Dull. Dull. Sharp. Sharp. Dull. Sharp. Sharp. Dull. Sharp. Dull. Sharp. Dull. Sharp. Sharp. Dull.
What I would like to do now is I'll have you lay down and I'll check your neck and your scalp where you mentioned that you're having some difficulty with your sensations, okay? I'm going to go ahead and palpate your lower back to see if I feel any pulsations here. Okay, does feel good. Doesn't seem to be a lot of inflammation, so what I'm gonna do is I will pull a little bit the skin to see if there's any kind of sound. Okay, that's good. Okay.
Okay.
Okay, the back of the neck is where you mentioned you're having that loss of sensation, and it's more on the right side than the left. You mentioned there's no painful stimulus, and to me it looks more like an impinged nerve. Now we're gonna have to work on the muscles as well to relieve some of that inflammation. I'm going to also check your scalp area. So I'll take a look at the hairline first. Okay. Does that feel sharp or dull?
Dull.
What about now?
Dull. 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 Dull.
Okay. And does this feel warm or cold?
Cold.
Warm or cold?
Cold.
Does this feel the same intensity as the first two?
Yes.
Okay. Let me know if you feel the intensity getting less or more as I'm moving down the hairline. Okay. Does this feel sharp?
Yes.
And is this the same amount of sharpness?
Yes.
Okay. Does this feel sharp?
Yes.
What about now? Does it feel sharp?
Yes.
And now?
Yes.
Does this feel warm?
No.
Does this feel warm?
No.
And does this feel warm?
No.
Okay, can you please tell me if this feels sharp?
It does not.
Okay, what about now?
No.
Okay. And can you tell me if this feels dull?
Sharp.
Okay, what about now? Is it dull?
Sharp.
And what about here? Is it dull?
Dull.
It is dull.
Yeah.
Okay. Can you please tell me if this feels warm?
Cold.
What about now?
Cold.
Okay. And does this feel sharp?
Dull.
Is this sharp?
Yes.
Does this feel dull?
No.
What about now?
No.
And here, does it feel dull?
Yes.
It feels dull.
Yes.
Okay, does this feel dull?
Yes.
What about now?
Yes.
And now?
Sharp.
Sharp on the lower side. Okay, does this feel sharp?
No.
Does this feel sharp?
No.
Is this dull?
Yes.
Okay. Is this sharp or dull?
Sharp.
What about here? Sharp or dull?
Sharp.
I'm noticing some abnormalities on the hairline on the left side, and I'm going to go ahead and do some adjustments on the scalp. See if we can relieve some of that impinged nerve and to articulate the muscles to activate them and decrease the pain. Okay, I'm going to use my thumbs here to find exactly where the inflammation is. So you're just going to feel my fingers touching you. Sometimes I'll apply some pressure, and if they turn red, then we'll know that we need to work on those pressure points. I'm going to use a sensory brush to stimulate the nerve endings. So I'll be focusing on the hairline, moving up the scalp. Taking some samples here to check them for any inflammation. I'm also looking for any raised bumps. Okay, we're going to send that to the lab, and I will work on your neck area as well. So I'm noticing there is a little bit of inflammation here. I would like to maybe get an MRI to check for any tissue damage. So first I will find the trigger points and apply some gentle pressure. That usually helps to alleviate nerve impingement and that loss of sensation that you're feeling. I'm going to work on the fascia as well. So you're going to feel multiple pressure. I'm not going to apply too much but also it will not feel too gentle either. This usually helps to remove toxins. Okay, you're doing great. This is gonna feel kind of sharp. I'll be applying some anti-inflammatory oil at the base of your hairline, and then I'll massage it in. I usually recommend to not wash your head and your scalp for the next 24 hours. Okay, very good. Well, thank you for coming in, and I will see you back in about 5 days. Is that okay?
Thank you.
You're welcome. Next person in line, move forward. Ma'am, stop. Passport and airplane ticket.
Here's my passport. My ticket is on my phone.
Sure. Let me go ahead and see that.
Sure.
And
It's
today, ma'am.
oh, sorry. Right here.
Okay. Okay. State your full name
Katie ASMR,
and date of birth.
March 24th, 1990.
Okay. Where were you born?
St. Louis.
Okay, where are you traveling?
I'm traveling from St. Louis.
Is it personal or business?
Oh, it's for fun. I'm going to see the Grand Canyon.
Traveling alone?
Alone, yeah.
Have you noticed any increased activity in the airport?
It seems pretty dead today, actually. I haven't seen much.
Okay, are you carrying any illegal substances, firearms, any drugs?
No drugs. Nope.
Okay.
More prescription medication, but that's it.
Okay, how often do you travel usually?
I try to get out a couple times a year.
So you're a frequent flyer. How come
Yeah.
I never see you over here?
Usually I don't fly this Airways. Yeah, I'm used to flying Katy Airways, but I thought I would switch it up and fly a different airline.
Okay, well, welcome to Mad P Airway.
Yeah.
Okay, let's go ahead and take a look. We're going to put this in our database here. I'll be right back, okay?
Okay. All right.
Ma'am, it looks like there's been some suspicious activity. Somebody used your passport recently, and according to our database, it doesn't look like it was you. And it's very abnormal that we have your passport again.
That's impossible. I keep it in a drawer by my nightstand.
Okay.
That's so crazy.
Yeah, I agree with you. It is, and we live in a very crazy world. Nothing is impossible. I'm going to hold on to this, okay? I'm gonna need your bag. We're gonna have to investigate that.
So someone stole my passport, or they stole my photo and made an...
We're gonna have to do more investigation, definitely. So,
Insane.
all right, I'm going to deal with this at the end. First, I'm going to do a pat down.
Oh, sure.
All right, can you please go ahead and empty everything that you have in your pockets?
There you go. That's it. That's all I got.
Okay, this looks good. I'm going to return this at the end.
Thank you. That'd be nice.
Okay, so go ahead and remove your jacket, please.
Sure.
Have you ever been on the no-fly list?
No, never.
Okay, this looks good. So as long as everything checks out normal now, I'm gonna be able to let you go, but otherwise I need to detain you. So let's go ahead and not jump to any conclusions. I would like to take a look at your full body. All right, go ahead and step forward. And okay, turn towards me. Okay, go. So I'm going to start with your head.
Okay.
Okay, let's go ahead and take some samples here. So we're going to take a sample and we're going to run it in our database.
Sure. I mean, like, what could possibly be in my hair?
You'll be surprised what people hide in their hair. Okay, ma'am, what is this?
What is what?
This right here. Something stuck.
Don't know what you're
under
referring
your-
to.
It looks like a I'm not gonna touch it. Like a recording device. Do not move.
Are you serious?
Do not move. Ma'am, what is this? Is this a recording device?
No. You know what? I had a bagel with poppy seeds earlier today, so maybe that's a poppy seed?
Well, how come it was behind your ear?
I'm a messy eater, to be honest.
I don't think so. I think this is a recording device.
I'm not trying to record anything. I'm just trying to...
Yeah, so you're trying to steal information from our airline?
No.
I believe you are.
Why would I... What information would I want?
Ma'am, we're gonna have to check. Please cooperate.
Okay.
Let's see if we find any more of these poppy seeds. Okay. Go ahead and turn around. I'm gonna check the other side.
Okay. I have no idea how that got there.
Does it hurt?
No, it doesn't hurt. I'm just trying to process the thing you just found in my head. I don't know.
Yeah, a lot of people try to act innocent. I understand that reaction.
This is ridiculous.
Okay, looks like there's only one, so it was one on the left ear. I don't see anything on the right ear.
Okay.
If you had one, it must have fallen. Okay, let's go ahead and check this. Yeah, I know it's messy, so...
Like, am I being punked right now? Like, where's the camera?
Ma'am, I take this job very serious. Let's not laugh about it, okay?
So just, okay.
All right. Let's keep going. Okay, looks good. We have one more brush. Okay. Okay. Okay, ma'am, go ahead and turn towards me. I'm going to start patting down your face as well, okay?
You're just rubbing my makeup all over, aren't you?
We want to make sure that you're not hiding anything.
Okay.
Okay. Checking neck, behind the neck. Okay. Go ahead and extend your arm. Armpit. Okay. It's going to take some samples. This is going to feel a little bit wet. So we're going to take samples from your fingerprints. whatever comes off, we're gonna go ahead and test this and under your nails. Okay. What happened there?
So these shoes that I have, they have like these fancy hooks on them, but one of my hooks got caught in the shoelace. I fell in the gravel and I hit my hand.
Oh.
So there's also a scrape on my knee too.
Oh, I'm so sorry. Okay, I'll be gentle.
Okay.
Okay, let's go ahead and check your other hand. Okay. Okay, go ahead and relax your arms.
Okay.
Okay. Okay, bear with me, ma'am.
I'm barren. Yep.
Okay, go ahead and open your mouth and extend your tongue out.
Really?
Yes. Okay, good.
Do you want to draw my blood too? I mean, this is...
Would you like to?
No. No.
Okay. Well,
You do that?
in emergencies, yeah. Yeah, definitely. All right, let's go ahead and check your waist. Okay. You're not wearing a belt, correct?
Nope. That's okay.
Okay. I'm going to check your lower body now.
Okay.
Okay, go ahead and open your legs a little bit. Good. I'm going to put my hands up the groin.
Okay.
I'm going to put my hands up the groin.
Okay.
Okay, ma'am, go ahead and turn around. I'm gonna have to inspect your torso.
Okay.
Okay, one step back.
Towards you?
Yes.
Okay.
Stop. Good.
All right.
Okay. Go ahead and open the legs.
Yes.
Okay. I'm going to put my hands up the groin.
Okay.
I'm going to put my hands up the groin. Okay. Go ahead and remove your shoes for me.
Okay.
Okay. Looks like there's no substance found on this shoe, but we have to test it.
Okay. You do you. Does that sponge thing do a different job than the brush?
Yeah. But we cannot disclose that information.
Okay.
We can tell you only the results. We can't tell you exactly what they're
Yikes.
used for.
Okay.
Okay, we're gonna have to send that to the lab. Okay, I will be right back with your shoes.
Okay.
Okay, ma'am. We have one more part. We're gonna have to inspect your feet as well. So go ahead and remove your socks very quickly, please. Very quickly.
Okay.
Fast,
I'm not
fast,
gonna
fast,
find
fast,
anything here.
fast.
I'm going as fast as I can. Just
Okay,
Seems
go
a
ahead
little
and
extravagant.
step a little bit forward
All
for me.
right.
Okay, turn around towards
Okay.
me. Good. No, towards me. Towards
All
me.
right.
Facing me. Okay, good. Okay, ma'am, go ahead and turn around. We're going to pat the sole of your feet.
Oh my gosh.
Okay.
I'm afraid I'm gonna miss my flight.
No, you're not. You just have to be very, very, very thorough.
Okay.
Okay, next foot.
Who do I file a complaint to?
Me.
Darn it.
I'm my own boss.
All right. That's too much, man.
Ma'am, please.
I don't think I'm gonna fly this Airways again.
That's okay. Okay.
Okay.
Is this your bag?
Yep.
Okay. That's everything you have?
That's it.
Are you carrying any illegal substances? Anything sharp?
No.
There's a very strange smell coming out.
Yeah, maybe it's the bagel. I did carry it in my purse for a while before I ate it.
No, I think we might have to bring the dog here.
Just eye drops.
What are these?
B vitamins. I'll take one right now. I actually forgot to take one.
You cannot take it right now. If you break these in the airport, in the airplane, what's going to happen with the liquid? It's too much liquid.
Yeah,
So we're going to have to confiscate
All right.
these.
Well,
Okay.
Okay. Just had them for celebration.
I'm sorry, ma'am, but
Just
before
to
you buy the ticket or before you come in, you have to read the rules. I keep on saying that.
Sorry.
I have one just the same.
Do you?
Yeah, I think. Is it mine or yours?
I had one. Is it pink mocha?
No, it's Hydro Boost.
No. The shade is
Pink mocha.
Pink mocha.
It's yours?
We have to make sure that I don't have both of yours then, because I took one from the counter, I thought.
No, I was just joking.
Okay, alright. Oh, we have the same one. Okay. Okay, that was me. Sorry about that.
No, not at all. If it's yours, it's yours. Okay, let's see. What do you have here? One key. Pet. Do you have a pet?
Yes.
You do?
Yes,
Okay.
I do.
And what is this?
This is a key fob that gets me into my apartment.
Okay. What's this?
It's a bottle opener.
Bottle opener.
Yeah.
Oh, drink a lot?
A little.
That's not good for your liver.
I know, okay?
Okay. Are you in a hurry?
No, it's just, my plane. Just catching my plane, but I guess that's not a big deal.
Okay. No worries. I know it is. I know it is. Just doing my job here. Oh, ew. Okay. What is this?
My dog's hair. I brush my dog and
Ma'am.
I know.
Ma'am.
I know it's not aesthetically pleasing. I should have thrown her away.
Do you keep it for a souvenir? Or?
No, it was just stuck in the comb.
Oh.
Yeah. Sorry.
I'm just gonna put it back. It's okay. We accept pets an hour.
Okay.
Here.
So, okay, let me put my little pet back, I guess.
Okay, so just some cash, earrings. Okay, I'm just going to put them back. Alright, I'll be right back with your bag.
Okay.
Ma'am, I'm going to give you your poppy seed back. It's okay, we don't need it. And yes, it is not a recording device.
Okay.
Just very unusual, and it does look like one.
Yeah, you really don't need it. It's a poppy seed.
Yeah, you can have it. Here is your...
Okay.
Yeah, you can do whatever you want with it. It's yours. I'm not allowed to throw anything unless it's illegal. It's not illegal to have poppy seeds, okay? Alright, so have a safe flight. You can keep going.
You betcha.
Next in line. How are you?
I'm good. I'm in a little bit of pain.
Okay, tell me more. Tell me what happened.
Yeah, so I'm not really sure if I did something, but I've been having pain in my neck and kind of like the upper back area.
Okay. Do you remember having an accident or doing something in particular and injuring yourself?
I cannot really remember doing anything out of the ordinary. It just, one day it just started hurting.
Okay. And is the pain getting worse? Worse at night? Worse when you lay down?
No, I think it's not really getting worse, but it's not getting better, and it's just there the whole day.
Okay, so from when you wake up until night,
Yeah.
and no matter what you do, it's not getting better.
Right. And it's even hard to sleep because it even hurts, and sometimes I wake up because of the pain.
Okay. And have you tried anything to relieve it?
Not really. I just tried some hot and cold. Didn't really help much. I try not to take medicine, so yeah, not really.
Okay, and how long has this been going on?
Probably about a week.
Okay, so it's definitely something acute that is happening, which is a good sign, not chronic, and we don't want to let it become chronic. Tell me a little bit about your daily activities. Are you pretty active? Do you sit down at work?
I do spend a lot of time sitting down at work. I do exercise at least 3 times a week, so I wouldn't say I'm super active, but I'm pretty decent.
Okay.
Yeah.
And do you spend a lot of time on your laptop or computer or your phone working?
Yeah.
Okay.
Mostly work on the computer.
Okay. So what happens sometimes when you overwork your muscles for an extended period of time, then your body starts to show some symptoms. So what I think is happening right now, your body has been in a lot of stress for a very long time, and now it's showing you the symptom, like, the pain So let's see if we can find a way of correcting it.
Okay, I love that.
It might be a posture problem that you're dealing with. Sometimes working a lot from a desk and on your phone, having this position could cause a lot of strain on your back muscles.
Yeah, that makes sense.
Okay, so let's see what we can do. I'm just gonna go ahead and try to assess first. So let's see what we find, okay? I'm gonna have you stand up first,
Okay.
and walk a few steps. Let's see how it looks.
Okay.
Okay, Ivy, so go ahead and just take a few steps like you would walk normally. Okay, that's perfect. And I'm just gonna go ahead and put the hair back. Just taking a look at your overall appearance and your posture, how you align your shoulders when you're relaxed. Definitely, I am seeing a lot of tension right here. So what we want to do in this session is to increase your spine mobility. We're going to do a few stretches, massage the muscles around your spine, and make sure that we allow your vertebrae to increase the space in between them. And that's definitely going to help with the overall pain and tension that you're feeling.
That sounds great.
So we're definitely going to start working on your back, and we're going to do a full body adjustment. Okay. Your shoulders are a little bit misaligned. I'm noticing your shoulder blades, how they're uneven. So what I'm going to do is I'm going to ask you to take one step back. Perfect. Okay. And can you please go ahead and touch your toes with your fingers? Good. Go ahead and come up. And now try to touch your lateral side of your knee. Good. And same thing on the other side. Okay. Good. And now go ahead and bring one arm at a time. Try to touch the middle of your shoulder blades. Okay. So that's pretty good. I'm not seeing anything bad there. And both arms actually have good mobility. So that's amazing. Okay. Let's go ahead and lay down. Okay. I'm gonna start working on the muscles on your neck. I'm just trying to loosen them up a little bit. Sometimes we're carrying a lot of tension on our shoulders. And just really stretching the cervical spine. Okay, go ahead and relax your head and your neck. I'm going to make some movements. Good. Okay. Opening up the spaces. Does that feel good?
Mm-hmm. Yes.
Okay, so we're going to do the first crack. We're going to relax the head, the neck muscles. Okay. Take a deep breath in and exhale. We're gonna do that again. Take a deep breath in and exhale. Okay, I'm gonna be applying an oil. It's gonna feel hot and cold. It's gonna feel a little bit weird, but definitely it's going to help a lot. Okay, so I'm going to just put a little bit right here on the neck muscles and on the other side. Just massage this part right here. This is where it felt very tense.
Yeah, that feels really good.
Does it hurt when I do this?
It feels a little bit tense. Doesn't hurt.
Okay, so that's a good sign. It means that we're working the right muscles, because if it wouldn't hurt at all, then, you know, we wouldn't be getting deep into the problem. So that's a good sign. Yeah, after today's session, you might feel a little bit sore all over your body. Again, that's normal and expected, since we're overworking a little bit the muscles today and really stimulating the fibers to expand, so we increase overall full body mobility.
That feels really good.
Over here?
Mhm.
Okay. So let's go ahead and keep on working this on this area then.
Yeah, that's where it feels very tense.
Yeah, I get this a lot too on my shoulders. It could be from a various reasons. Driving, even just sitting down at a task, doing, just doing no exercise. And sometimes repetitive movements can cause this kind of stiffness too.
Oh, that feels really good.
Yeah, so this is called scalp massaging, and really stimulates the nerve endings of your cranial nerves. And that cranial nerves, they start from the brain, but they move throughout the body. So by stimulating this part, really you're just increasing the connectivity between your nerves. So it's going to help a lot. Go ahead and relax. That one by itself. I didn't have to do anything. Okay, so I'm gonna move down to the feet. Okay, I'm gonna go ahead and remove your socks. Are you ticklish at all, Ivy?
No, not very much.
That's good. Okay. So go ahead and put your feet together. Yeah. Did you know that your right foot is a little bit longer than, but that's not really longer, it's just a shift in your pelvis. And once we do the readjustment, we should see them more equal.
Okay.
Yeah. Okay, can you please pull your feet towards you and try to resist? Good. Okay, and now go ahead and push with the pads. Okay, good. And with your heels. Good. Okay, so I would say that was symmetric. And I'm gonna try to open your legs. Don't let me do that, okay? Okay, good. Okay. Relax your leg and your foot. Okay. Relax. Okay. Good. Good. Okay. Okay, just like that. Perfect. So now go ahead and put this foot right here on my shoulder. Perfect. And this one, we're going to cover your other one. So go ahead and put your arms like on your chest. Good. Take a deep breath in for me. And exhale. Okay. All right, let's go ahead and switch. So now we're going to put this foot right here. Okay. Go ahead and take a deep breath in and exhale. Okay, excellent. Love it. Perfect. So what we're gonna do now is we're gonna try to realign your shoulder blades, and by doing that, I'm gonna just put your arms like this behind your neck. Perfect. I'm gonna come behind you, and I'm gonna ask you to take a deep breath in and breathe out. Push your shoulders together. Okay. All right, let's go ahead and do that one more time, okay? So try to keep your shoulders like this. Okay. Take a deep breath in and breathe out. Okay. Good, looks good. Ivy, so let's go ahead and continue to readjust your hips. Now I'm gonna have you take this foot Okay, this one is straight. Okay, and we're going to stretch a little bit. All right, so take a deep breath in. 1, 2, 3, and exhale. Okay, perfect. Let's go ahead and switch sides. So same thing. And put this arm like this. Okay, so take a deep breath in. 1, 2, 3. Okay, good. That looks good. Okay, so it's really important that we increase your spine mobility. That's definitely gonna help with the pain and tension that you're feeling in your upper back. Okay, so we're gonna start by working on the lower side of your spine. I'm gonna need you to take a deep breath in and breathe out. Good. Okay. Again, take a deep breath in and breathe out. Good. Okay. Again, take a deep breath in and breathe out. Excellent. Okay. Okay. Go ahead and take another deep breath in and breathe out. Good. Again, take a deep breath in and breathe out. Okay. And now we're going to readjust just the lumbar side of your spine. Okay, so this side definitely feels very tense. Okay, go ahead and take a deep breath in and breathe out. Okay. And again, take a deep breath in and breathe out. Okay. Good. I'm going to put this biofreeze. It's gonna be cold and hot at the same time, a very weird sensation, but it really helps with inflammation and with muscle regeneration. Okay, now it's gonna feel a little bit stronger. I'm gonna go ahead and push with my, how do you call this?
What?
What?
What are you talking about?
Elbow. Okay.
Oh. What is this?
Okay, now it's gonna feel a little bit stronger. I'm going to go ahead and push with my elbow. I just want to make sure that I'm, working on these knots that I'm feeling right here. And just pushing down. Okay. Okay. Okay, I'm going to apply some kinesiology tape right here along the spine. It's going to help to keep the muscles together and to decrease inflammation. You can keep the tape for about a week. You can take a shower with it, just pat it dry with a towel, and it's pretty strong, so it should stay on for about a week. So I'm gonna put another one on the other side. Make sure that we're balancing right and left. Take a deep breath in and breathe out. Okay. Take a deep breath in, breathe out. Take a deep breath in, breathe out. Okay, good. Okay, so let's go ahead and sit up and discuss the results. Well, how do you feel?
I feel amazing.
Okay,
Yeah, I hadn't felt this relaxed in a really long time.
I'm glad. I did a full body adjustment. Now, I think you're gonna feel a little bit lighter compared with when you came in.
I do, definitely.
Yeah, so it's gonna be very easy on your joints. You're going to feel less pain in your spine, and we could do another readjustment in about 1 month. I don't like to do a full body adjustment too frequently because that's not good either. So, would you like to see you soon in 1 month?
Yeah.
Okay.
Can I make my appointment when I walk out of here?
Definitely.
Okay. I will.
Okay. Well, thank you so much for allowing me to do this exam on you.
Thank you.
Pain there. And in the back, I'm not noticing any kind of lumps. No pain, no tenderness.
No.
Anything on the other side? Hi, Katie.
Hi, how are you?
Good, how are you?
Really good.
My name is Dr. Matt. I'm going to be your doctor today.
Okay.
So I see here that we have a 2:30 p.m. appointment.
Mm-hmm.
And I do have some medical history from you, but is there anything else that I should add up?
Just lately, I've been having insomnia.
Okay. And have you tried anything? Is anything helping?
I take melatonin. That's over the counter, and I listen to music. Meditation
Okay.
is always really good.
Wonderful.
Yeah, sometimes I just wake up early. Yeah, go to bed super late.
Okay. Well, if you need any extra help from me, just let me know, and we can definitely make a treatment plan for you and help you out with that further.
Thank you. Okay, thanks.
Okay. Any allergies allergies that I should be aware of?
No.
Okay. Any surgeries since the last time I saw you?
No.
And on a scale of 0 to 10, are you having any pain right now?
No pain.
And would you say that on a scale of 0 to 10, your pain level is a 0?
A 0, yeah.
Okay, perfect. Okay. Anything in particular that you would like me to address today?
I guess my back has been aching a little, just like in the midsection.
Okay.
But other than that, I'm really good.
Okay. I can definitely take a look at your back and make sure that everything is okay.
Thank you.
Let's see. Do you remember doing something in particular that you may have hurt your back?
Just like carrying groceries for my car the other day, I had like a lot of stuff and I didn't really give myself a break, so I think that might have been it.
Okay.
Just lifting something.
Okay, and how would you describe the pain that you felt at that moment?
I mean, I don't know exactly when it happened, but it was after I did groceries, and it's just kind of like a dull pain.
Dull.
Like in the middle of my back.
And you're not having any pain right now?
No, no.
Good. Okay, so let's go ahead and check your vital signs first.
Sure.
Okay, have you experienced any headaches
Mm-mm.
in the last 2 weeks? Any tingling sensations?
No.
Okay. Any numbness in the legs or feet?
No.
Okay. Any flu-like symptoms?
Nope.
Are you taking any daily vitamins?
I do. I take a multivitamin.
Okay.
Yeah.
Good. Okay, so let's go ahead and check your pulse first.
Sure.
Okay, just relax. Okay, so Okay, so both pulses are symmetric, 2+, synchronizing. Very good, and your heart rate is about 73 beats per minute, so that's very normal.
Yeah.
Okay, go ahead, relax. I'm going to take your temperature. This is going to go on your forehead.
Okay.
Great. Your body temperature is 98.5. Do you have an arm preference?
This one's good.
All right, let's go ahead and take your blood pressure.
Sure.
So just relax your arm. Can you hold this up for me, please?
Yeah.
Okay. Okay, very good. Your blood pressure is 110/65.
Is that good, I hope?
Yes, that's very normal. And accompanied by the fact that you're not having any symptoms, that's very reassuring.
Good.
I'm gonna go ahead and listen to your heart and your lungs. Just going to move your hair a little bit on the side. Okay, so just relax. You don't have to take a deep breath in. Just breathe normal. Okay, so I'm able to hear only S1 and S2. No extra sounds. Let's go ahead and check with the pill. I'm looking for any murmurs. Okay. Everything sounds very normal. go ahead and check your lungs now. So just take a deep breath in and exhale. Good. Take a deep breath in and exhale. One more time. Take a deep breath in and exhale. Good. I'm just going to ask you to put your arm like this, and I'm going to listen to the side. Take a deep breath in and exhale. Good. Let's go ahead and switch it up. Take a deep breath in and exhale. Good. I'm going to listen to your back. Just relax. Okay. Okay, so just take a deep breath in and breathe out. Take a deep breath in and breathe out. One more time, take a deep breath in. Good. And last time, take a deep breath in and exhale. Very good. Okay, so I was not able to hear any extra sounds. Your lungs sound very clear.
Good.
Let's go ahead and write this down. So no bronchi, no wheezing, no signs of pneumonia or infiltrates. Okay, your heart rate was 73. Temperature was 98.3. Blood pressure 110/65. Okay. Alright. So what I'm going to do now is I'm going to check your head.
Okay.
Okay. So first I'm going to take a look at your whole appearance. I'm not noticing any cyanosis around the mouth. And very well skin perfusion, no lumps, no bumps visible to the naked eye. And is it okay if I touch your head? I'm just going to check for any lumps that maybe you may have missed.
Sure. Yeah.
Let me know if you have any pain.
Thank you.
Okay, touching the mastoid process. No pain there. In the back, I'm not noticing any kind of lumps. The head is very symmetric, round. Okay, is it okay if I check your hair follicles and your scalp? Okay, so first I'm going to examine with the light. Okay, I'm just gonna have you move your head like this. Okay, just relax. Okay, go ahead, turn your head like this. I'm going to take a look at the left side. this. Just gonna take a look inside the back here. Okay. Everything first looks very clean and healthy. Okay, so everything looks good. The hair follicle is very healthy. I wasn't able to notice any dandruff. And I'm gonna go ahead and just slowly palpate your face. Let me know if you feel any kind of pain or tenderness.
Okay.
Okay, and I'm palpating underneath the mandible for any signs of swollen limbs. Can you go ahead and swallow for me, please? Okay, very good. Looks good. Okay, I'm going to slowly tap on your face. Okay, now I'm just palpating a little bit above the clavicle. Go ahead and check your skin. Very good. Okay, go ahead, relax. I'm going to check the circumference of your head.
Okay.
Okay, very good. Go ahead, close your eyes. Tell me if you feel this.
Yeah.
And where exactly do you feel it on your face?
In the middle of my forehead.
Very good. Where do you feel this?
On my cheek.
Good. Where do you feel this?
On my left cheek.
Very good. What about this?
My chin.
Okay, perfect. Can I please have your palm?
Yeah.
Okay. So this is sharp and this is dull. So we're going to do the same exercise on your face. Just
Okay.
close your eyes.
Right.
Tell me if this is sharp or dull.
Sharp.
Good.
Dull.
Good.
Dull.
Good.
Sharp.
Good.
Sharp.
Very good. Okay. Tell me if you feel this.
Yes, I do.
Okay, where do you feel it?
On my ear.
Do you feel this?
Yeah.
Okay. On which side of your head do you feel it?
On my left side.
Okay. Okay, Katie, I'm gonna go ahead and check your eyes.
Okay.
So I'm gonna need you to look right here in my nose, okay? Keep your head still. Good. Keep your head still. Okay, I'm gonna do that back and forth a few times. Just keep on looking at my nose. Very good. I'm going to slowly touch your face right here. Just check your conjunctiva. Very good. Okay, so I'm going to have a look right here in my fingers. Very good. Now look right here. Okay. Can you please tell me which fingers are moving right or left?
You're right.
Good.
Left.
Good.
Both.
Good.
Both.
Good.
Right.
Good.
Left.
Perfect.
Right.
Good.
Left.
Perfect.
Both.
Okay.
You're right.
Good.
Left.
Very good. Okay. Now go ahead, please tell me when you don't see my fingers in your field of vision.
No more.
Good.
Now.
Good.
Now.
Good.
Now.
Perfect. Okay. I'm gonna have you cover one eye for me, please.
Sure.
Okay. Perfect. So can you please read the last row starting from the first one?
LTFPH.
What color is this?
Red.
What color is this?
Green.
Okay. Can you please tell me what number you see here?
5.
Very good. What number do you see here?
9.
Which circle is bigger, 5 or 9?
9.
Good. Go ahead and stitch it up.
Okay.
Okay, perfect. Can you see here?
Yes.
Very good. Can you please read the last row starting with this letter?
Sure. HPFTL.
Very good. What color is this?
Green.
Good. What number is this here?
6.
And what number is this?
8.
Which one is smaller, 6 or 8? The circle.
6 is smaller.
Very good. Okay, I'm gonna have this. You're doing great so far. So let's go ahead and check your colors.
Okay.
Okay, so can you please tell me what color this is?
Green.
Very good. What color is this?
Blue.
Very good. What color is this?
Yellow.
Very good. What color is this?
Orange.
Wonderful. Okay, so what I'm going to do now is I'm going to check your ocular nerve. I'm going to come a little bit closer, but I'm going to have you focus right here in front of
Yeah.
you. Okay, so just keep on focusing over there. And try not to move your eyesight from here.
Okay.
Perfect. Okay. Okay. So the ocular nerve is intact on the left side. Very good. Let's go ahead and check your other one.
Okay.
Yes. I'm just going to slowly press down. Very good. So the ocular nerve is intact. Very healthy looking on the right side as well. And you're not noticing any blurry vision, double vision. Good. I'm gonna go ahead and take a look inside the ear canal.
Sure.
Taking a look. Tympanic membrane is intact. Margins are very well defined. I'm not seeing any extra discharge, no redness, just a normal amount of earwax. That's good. Okay, very healthy. Let's go ahead and take a look on the other side.
Sure.
Good, just turn your head like this. No pain, no tenderness,
No.
no lumps. Very good. Okay. Tympanic membrane is pearl gray. No signs of infection or inflammation. The eardrum is intact. Margins are very well defined. Wonderful. go ahead, keep your eyes closed. Okay, so I'm going to make a vibration sound to tell me when the sound stops. Which one is louder? Position number 1 or position number 2?
2.
Okay, good. And I'm gonna do the same thing on the other side. And which one is louder? Position number 1 or position number 2?
2.
Perfect. Go ahead, keep your eyes closed. Can you please repeat this after me? ASMR.
ASMR.
Good. Octopus.
Octopus.
Mad B ASMR.
Mad P ASMR.
Wonderful. Tell me when the sound stops.
No.
Good.
No.
Okay. Tell me with which ear you hear the sound.
My left.
Good.
My right.
Good.
Both.
Great. Tell me how many times you hear this sound.
3.
Good.
4.
Very good. Tell me with which ear you hear this sound.
Ooh, my left.
Good. Tell me with which ear you hear the sound.
Right.
Good. See, so now I'm going to check your nose. I'm just going to slowly palpate. Let me know if you feel any kind of pain. Okay. Can you please breathe in, breathe out? Good. Breathe in, breathe out. Very good. So both nares are patent. I'm going to go ahead and check your nose inside. Just look up. Okay. Good. It's a normal mucosa. It's pink and moist. No foreign objects. No deviated septum. Good. Let's go ahead and check your other nostril. Look up. Good. Okay. Same thing. Looks very healthy. Pink and moist. No foreign objects. Great. Okay. Can you please identify this taste? Smell. Okay, can you please identify this smell? Go ahead, cover one nostril for me.
It's mint.
Great. Go ahead, cover your other nostril now. What does that smell like?
Licorice.
Very good. And now you don't have to close your nose, just breathe in and tell me what this smells like.
Sage.
Perfect. Now I'm gonna ask you to give me a big smile. Good, no frown. Puff your cheeks. Keep them puffed. Okay, go ahead, relax. Can you please clench your jaw? Okay, I'm gonna try to move it side to side. Don't let me do that. Keep it clenched. Good. Good, very strong muscles. Go ahead, open your mouth. I'm just gonna check your tongue. Okay, mucosa is very pink and moist. I'm not noticing any lumps. Gums look very healthy. Can you please move your tongue side to side?
Sure.
Good. Now up and down. Okay, very good. And I'm just gonna check your teeth really quick. I want to make sure that you don't have any hidden cavities. So what I'm gonna do is I'm gonna slowly tap on your teeth. Let me know if you don't feel any kind of pain.
Okay.
Okay, go ahead, open your mouth. Any pain there?
Mm-mm.
Okay, good. Good. And on the other side. Good. Very good.
Okay.
Okay, so what I'm going to do now is I'm going to put one drop on your lip. Can you please tell me what this tastes like?
Tastes like flowers.
Okay, very good. Let's go ahead and try one more. Can you please identify this taste?
Tastes like an orange.
Wonderful. So your smell and your taste is intact. I'm not noticing any abnormalities there.
Good.
And now we're going to go ahead and move down the arms, and I'm going to check your back as well.
Sure.
Okay, so what I'm going to have you do is just put your arms like this for me. First, I'm going to check your strength. Don't let me put your arms down. Good. And now I'm going to try to lift them up. Don't let me do that. Okay, good. I'm going to try to open them. Don't let me do that. Good. And I'm going to try to close them. Don't let me do that. Please squeeze my fingers hard as you can. Very good. And I'm just going to make some movements with your arms. Okay, so no pain there. Good. Okay. And I'm just going to feel your arm for any lumps. Any pain when I do this?
No.
Okay, so I'm just going to check for any edema. Good. Skin looks very well perfused. And I'm taking a look at the nail beds. I'm checking the capillary refill, which is a 2+. Very good peripheral circulation. Your hands do feel a little bit cold.
Yeah, they get cold quite easily. Yeah.
Okay. Good. Let's go ahead and check your other hand. Okay. Go ahead and check your palm. Skin is dry. Very normal. Soft. No scratches. And no pain. Okay, I'm gonna have you put your fingers like this for me, please. Don't let me close them. Good. Don't let me close them. Good. And I'm gonna do the same thing on the other side. Keep them spread out like that. Don't let me close them. Good. Okay, very good. Let's go ahead and check your abdomen.
Okay.
Okay, let me know if you feel any kind of pain. Good. Okay, I'm gonna slowly tap on your chest and your abdominal area. I'm gonna go ahead and listen to your abdomen. Normal bowel sounds. Which indicates very good digestion.
Good.
Okay, great. So what I'm going to do now is I'm going to slowly palpate your abdomen. Let me know if you feel any kind of pain. I'm not sensing any lumps. No swollen organs. Liver seems to be very normal size.
Good.
No pain, no tenderness felt. Okay, I'm going to palpate a little bit deeper now.
Okay.
Any pain?
No.
Okay. So no signs of organ enlargement, which is great.
Good.
Okay, I'm gonna have you lift up your arms. Go ahead, lift them up. Alright, very good. I'm gonna go ahead and listen to your neck. Just relax. Okay, no bruising on either side. Good. Okay. I'm gonna go ahead and check your feet. So I'm just checking the pulses. 2 plus, strong.
Mm-hmm.
Okay.
That feels warm.
Yeah. Your feet are a little bit cold.
Yeah.
Can you please push with your heels first?
Sure.
Good. Now push with the front face. Okay, good. And don't let me pull your feet. Good. And just push one more time. Wonderful. Good. Please tell me if you feel any kind of pain or tenderness while I'm doing this.
Feels good.
This is supposed to stimulate the body. And the skin. Relax. I'm gonna do the same thing on the other side, and then we're gonna do both arms at the same time.
Okay.
Okay, relax. Relax both arms. Okay, good. Okay, put your arms like this. Good. Wonderful. Go ahead and relax. You can pull the sleeves back down. Okay, Katie. How are you feeling today?
I'm good. I'm really
Okay.
relaxed now.
Wonderful. So the exam came back positive. There is nothing to worry about. Everything looks very good and healthy. And I'm gonna see you back in a few months. Is that okay?
Yeah, that sounds really good.
Okay, let's go ahead and make the appointment. So is 2 p.m. okay for you
2 p.m. is really
on
good, yeah.
March 22nd?
Yes.
Okay. Great. Well, if you have any medical problems, don't hesitate to call the office. And otherwise, thank you so much for allowing me to do this medical exam on you.
Thank you. It was really, felt really good.
Wonderful. Hi, Miso. Hi. I'm gonna go ahead and take a look at your scalp. Okay. Is there anything in particular that you're worried about?
Not really. I just want to get a little checkup and see everything is okay.
Okay.
I'm going to start by examining your head, looking for any lumps, any deformities, making sure that everything is symmetric. We have lots of glands in the back of the neck as well, and in the back of the ears, right below the mastoid bone. We're looking for any swollen lumps. I'm not noticing any raised papules, which is a good sign of healthy scalp. Okay. Good to start by dividing the hair and taking a look at the skin. I can see that you have very thick hair. It does look healthy, but the scalp line seems to be kind of dry. And in this session, I'm also going to test your sensitivities, and if needed, we're going to go ahead and start with a treatment.
Okay.
Can you please tell me how many times you feel less tapping?
1, 2. 2. 1. 1. 2. 3. 1.
Okay. I'm just going to touch you with a metal object. I'm looking to see if there is any edema. Skin seems to be a little bit swollen. Sometimes that can be a sign of dehydration. I'm going to touch you with two sides of this object, and I'm going to need you to tell me if you feel two pointy sides or just one.
Okay. One. 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 One.
Okay. I'm going to touch you with two objects. One is going to feel sharp. This is what the sharp is going to feel like.
Okay.
And the other one is going to be dull. This is what the dull is going to be like.
Okay.
Go ahead and tell me if you feel this sharp or dull.
Dull. Dull. Sharp. Sharp. Dull. 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 Sharp. I think that was dull. Dull.
Okay. And can you please tell me if this feels cold or warm?
Warm. Cold. Cold. Warm. Warm. Cold. 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 Warm. Warm.
I'm going to take a few measurements here. We're looking to see for the degree of inflammation. Go ahead and tell me if you feel this cold or warm.
Cold. Cold. Warm. Warm.
And does it feel sharp?
Yes.
And now?
Yes.
Does this feel sharp all the way?
Yes.
Okay. I'm going to touch you with two objects. One is going to feel metal. This is what metal is going to feel like.
Okay.
And the other one is going to be plastic. This is what plastic is going to be like. Go ahead and tell me if you feel metal or plastic.
Metal.
plastic, plastic, metal, 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 plastic, plastic, plastic.
Okay. And now go ahead and tell me if you feel this sharp or dull.
Sharp, dull, 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 dull.
Okay. I'm going to take a sample from the skin and we're going to go ahead and test it. So I'm going to apply a spray. This is going to help to be able to remove the cells. And I'll be collecting a sample now. I'm going to take a look at the hairline in the back of your scalp. Okay. We're looking for inflammation, any redness, notice a slight edema, also showing some dehydration. Okay, go ahead and tell me when you don't feel the vibration anymore.
Don't feel it. No. No. No.
Okay, now tell me, does this feel equally on both sides, left and right?
What do you mean?
So the vibration, if it goes equally on both sides of your head.
Okay, good. Yes, it's on both sides.
Okay, perfect. Okay, go ahead and tell me, does this feel sharp all the way?
Yes.
What about now?
Yes.
And does this feel dull?
Yes. Yes. That was more sharp. I can't tell with that one. Dull. I think that was sharp.
Okay, does this feel cold or warm?
Cold. That's colder. Cold. Warm. Warm. Warm.
Okay, good. Does this feel 2 or 1?
1. I'm not sure. 2. I think it was 2. 2. 1.
I'm going to apply acupressure therapy. So it's going to leave kind of an indentation in the skin. This helps to trigger the nervous system to lower inflammation. going to apply an anti-inflammatory treatment right at the base of the skull. This is a very relaxing oil. It has eucalyptus infused tincture. And this serum helps to regenerate hair follicles. Okay, go ahead and massage this in. I'm going to use a singing bowl to create a very relaxing environment, and we're going to make some vibrations that will really relax your scalp. We're going to pair that with just a gentle hair brushing.
How
Katie.
are you?
I'm great. How are you?
I'm pretty good. Well, not the best.
Okay.
So I was climbing a tree with my nephew. We were going camping over the weekend, and I fell off of a low branch. So it's not like it was a horrible injury. I mean, I walked fine after that, but my shoulder really has been feeling like disjointed and tight and weird.
Okay.
And then like also because I kind of felt like this on the ground, it's gone up to like my neck and jaw area. Like I've just noticed like when I chew and just it's just a lot of tension here. So
on a scale of 0 to 10, how would you rate your pain?
5.5.
Okay. And are you experiencing any dizziness?
No dizziness.
Any numbness or tingling sensations?
No.
Okay. Have you had any seizures since the accident?
No, thankfully no.
Okay. Have you noticed that your one part of your body is going numb, like you can't move it?
No, it's just tense, so I can still move it all, but it just doesn't feel quite right.
So it definitely, to me, it sounds like you might have injured a ligament or a muscle, but I want to make sure that I'm ruling out something more serious. Maybe during the fall you might have hurt your temple or your head, maybe in the back. So I just want to make sure 100% that there's nothing like that.
Yeah, like a brain injury.
Yeah.
I don't want that.
No. So we're going to do a cranial nerve exam, and I'm also going to check your shoulder.
Thank you.
You're welcome. Go ahead and take your vital signs. Have you noticed any fever since the accident?
No.
Okay. Okay, I'm gonna put this inside your mouth, underneath the tongue. Okay, so go ahead and just hold it. Looks like good temperature, 36.9 Celsius. And I'm also going to take your oxygenation. This will go on your index finger. Okay, just take a deep breath in, relax. Okay, your heart rate is 75 beats per minute and your oxygenation is 98th percentile in room air. That looks good.
Great. Nice.
You're welcome. Okay. And I'm also going to check your heart.
Okay.
Your heart sounds great. I can hear only S1 and S2, no S3, no S4. And let's go ahead and check you for murmurs. Make sure that there are no valve abnormalities. Okay. Can you take a deep breath in and hold it in for 1, 2, 3, and breathe out. Good. Okay, so I couldn't hear any murmurs, so I'm going to listen to your lungs. Take a deep breath in and breathe out. Good. Again, take a deep breath in, breathe out. Good. And I'm going to listen to the signs. Take a deep breath in and breathe out. Excellent. Same thing on the other side. Take a deep breath in and breathe out. Okay. I'm going to listen to the back. Take a deep breath in and breathe out. Good. And on the other side, take a deep breath in and breathe out. Good. So no signs of pulmonary edema. That's great. I'm going to check your pulse. So I'm just going to put my fingers right here on your wrist and just make sure that they're both equal and synchronizing. Okay. So pulses are 2+. Perfect. Everything looks good. Okay. Can you please squeeze my fingers?
Yes.
Tight, 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 tight. Okay, great. And I'm going to check your abdomen to make sure that you didn't injure any internal organs. Is that okay?
Yes.
Okay. I'm going to slowly percuss and then palpate.
Sure.
Just gonna ask you to move that hand here. Okay. Okay, so I'm hearing only normal sounds. No signs of any fluid. Perfect. And now I'm gonna go ahead and gently palpate. Let me know if you feel any kind of pain, and if you do, I'm gonna stop.
Okay.
Okay, relax. Good. I'm not noticing any masses. No tenderness. Perfect. Okay. Alright, I'm gonna go ahead and do a quick cranial nerve exam. The first thing that I'm going to do is to check your face, your facial sensation, and the muscles that are coordinating your vision, your smell, and your taste.
Alright, sounds good.
Okay, great. So what I'm gonna do first is to palpate your face.
Alright.
Let me know if you feel any kind of pain. Okay, I'm gonna go ahead and tap. Perfect. Just gonna ask you to move your head a little bit this way. Great. Good. Good. Can you please clench your jaw? Good. Go ahead and open. Okay. Can you stick your tongue up and down for me? Good. And now side to side. Can you please smile? Great. Now go ahead and frown and puff your cheeks. Keep them puffed for me, please. Don't let me unpuff them. Perfect. Go ahead and relax. I'm going to try to move your jaw side to side. Don't let me do that, okay? Go ahead and look that way. Good. And same thing on the other side. Perfect. Can you please shrug your shoulders? One more time. Great. And now, can you lift up your eyebrows? Okay, I'm going to try to push them down. Don't let me do that. Go ahead and keep them up. Good. Okay. Can you please close your eyes? I'm going to try to open your eyes. Don't let me do that, okay? Perfect. Go ahead and relax. And I'm going to try to move your nose. Let me know if you feel any kind of pain, okay? Good. Perfect. Okay. Any pain right here behind your ears?
No, it feels good.
Okay. Any pain when I pull up? Back?
No.
Down?
No.
Perfect. I'm just going to do a quick neck exam as well. Go ahead and look all the way down. Any pain when you do that?
Mm-mm.
Okay. And I'll look all the way up in the back as much as you can until it hurts. Okay. That looks good. So no mobility problems there. That's perfect. And can you please put your arms like this for me?
Yes.
Good. I'm going to try to push them down. Don't let me do that, okay? Good. I'm going to try to open them. Don't let me do that. And close. Don't let me do that. And push up. Perfect. Go ahead and relax. Okay. I'm just going to check your reflexes. Good. 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 Okay. Let's go ahead and check your facial sensation. Can you please extend your palm? I'm going to show you what sharp is. This is sharp, and this will be dull. Can you please close your eyes and tell me if it's sharp or dull?
Dull. Sharp. Dull. Sharp. Dull. Sharp. Dull. Sharp. 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 Dull. Sharp. Sharp.
Perfect. Okay, look towards me, please. Close your eyes and tell me if you feel this.
Yes.
Good. Tell me if you feel this.
Mm-hmm.
And if you feel this.
Mm-hmm.
Did you feel that equally on both sides?
Yes, I did. Yeah.
Okay, so that's very reassuring. That means that you are still having your full sensation in your face. That's perfect.
Okay.
I could not notice any twitching and no droopness of the eyes either.
Okay.
Also, your mouth is symmetric, so that's really great.
Great.
I'm gonna go ahead and check your sensation to cold. This will definitely feel cold on your face and on your body. But can you please tell me where you feel it, okay? I'm going to check it on your arms as well and on your face.
Right. My left cheek. My right side. My forehead. Both of my cheeks. My forehead. My left chin. My right cheek. My left cheek. My both temples. My chest. My other chest. My arm.
Which one?
Oh, my left arm.
Go ahead and be a little bit more exact, okay?
Okay. Alright, sorry about that. So
That's
my
okay.
right shoulder, my right elbow.
Okay.
My right elbow. My left forearm. My left hand. Both of my hands. Both sides of my chest.
Perfect. Okay. That's wonderful. I'm gonna go ahead and check your hearing. And what I'm going to do is I'm going to create a vibration sound. I'm going to put it right here behind your ear.
Okay.
Let me know if you are having if you're experiencing any buzzing, any very loud noises while I'm doing this, okay?
Okay, should it be loud?
It shouldn't.
Okay.
It should not bother you, but
Okay.
sometimes when patients have neurological disorder, then some sort of things could happen. So
Yeah.
just alarm me and
Okay.
we'll reassess. Do you hear it?
I do, but it's pretty faint.
Can you still hear it?
No.
Okay. Do you hear it?
Yes.
Tell me when it stopped.
Stopped.
Good. Okay. And now I'm going to put it in two positions. Tell me if it, which one is louder, position number 1 or position number 2.
Okay.
So this is position number 1, and this is 2.
2 is definitely louder.
Okay, that's perfect. This is position number 1, and this is number 2.
Number 2 is louder.
And I'm going to check the inside of your ears for any cerebrospinal fluid.
Okay.
Okay, go ahead and look that way for me, please, and relax. Okay. I'm not really seeing any signs of cerebrospinal fluid, which is great.
Good.
And same thing on the other side. Okay, go ahead and look that way for me, please, and relax. Tympanic membrane is pale gray. And margins are very well defined. I'm not seeing any kind of fluid behind the drums.
Good.
Yeah. Okay. I'm gonna go ahead and check your pupil dilation.
Okay.
So go ahead and look straight at my nose. I'm going to flash a light in your eyes just for a second. Good. Good. And now I'm gonna go ahead and lower your eyelid to take a look inside your eye. Go ahead and look up. Good. And look up again. Good. Okay. I'm going to check your ocular nerve. So for this, I'm going to ask you to look behind me, straight at the wall. Keep your eyes open. And I'm going to look inside your eye with the light. Okay. Okay, optic nerve is intact. I'm not seeing any scratches. And no signs of any infection.
Good.
Let's go ahead and check your other one. Okay, so go ahead and look behind me, straight at the wall. Can you look up? Good. And now look down. Excellent. So I was not able to see any nerve damage in both eyes.
Okay.
So that's great. And since you're not experiencing any double vision or blurry vision, I'm going to take that as negative signs for any disorders or any damage from the accident.
Okay, that's good.
Okay, so go ahead and cover one eye.
Okay.
Perfect. And what I'll do is I'll bring an object in your field of vision. I'm going to need you to tell me when you see that object, okay?
Okay. Now.
Good.
Now.
Okay.
Now.
Good. Okay, let's go ahead and switch.
Okay. Now.
Let's do that again.
Now.
Okay.
Now.
Good.
Now.
Good. Excellent.
Okay.
All right. Go ahead and follow my finger with your eyes only. Don't move your head. Okay. Okay. So good eye mobility in all 6 quadrants. That's perfect. And let's go ahead and check your taste. I'm going to put 1 drop on your tongue. Can you please identify this taste?
Sure. Lemon meringue.
Okay, perfect. I'm gonna go ahead and try one more.
Blueberry.
Okay, perfect. Okay. Ooh. Okay, can you please give me a big I'm just gonna check the inside of your mouth. Perfect. And I'm gonna check your nose. Make sure that both ears are patent. Breathe in, breathe out through your nose. Good. In, breathe out through your nose. Okay. So let's go ahead and check your smell. Can you please close one ear? Okay. And tell me what this smells like. Okay. And go ahead and close your other ear now. Again, please tell me what this smells like.
Watermelon.
Perfect. And with both ears now.
Eucalyptus.
Perfect. So no abnormalities there. Okay, and now I'm gonna go ahead and check your shoulder, see if you need any adjustments, if you need any kind of kinesiology tape. Sometimes that helps. And I can also just massage the joints, make sure that we're, lubricating the joints to help with inflammation.
Sure, that sounds great.
Wonderful. So I'm gonna have you undress so that I can have a better exposure of the shoulder, okay?
Sure. Yeah.
Great. I'm gonna go ahead and compare with the other one. This is the best way to make sure that there is no inflammation, and if there is, you can definitely notice by comparing. Okay, so both have normal temperature, which is good, but I'm definitely noticing that the muscles attaching to the shoulder joint are a little bit inflamed and also tender.
Yeah, it does feel tender.
As compared to your left shoulder.
Right.
Okay. I'm going to make some movements with your shoulder joint, okay?
Sure.
Now, if it hurts at any moment, just please tell me. I'll stop and I'll reassess.
Okay.
But otherwise, just go ahead and follow my directions, okay?
Sure. Yeah.
So I'm going to move your arm like this.
Okay.
Go ahead and you do it on your own, okay? I don't want to push you or push your shoulder joint too much. Good. And now go ahead and break it back down. Okay. And now extend your arm so that you can make a 90 degrees with your body. Okay. Go ahead and extend it all the way up. Okay. Any pain there? Any pain here?
Slightly, just like a little soreness.
Okay.
Yeah.
So it's whatever is inside here. Okay. Okay, definitely know what the cause is. Now go ahead and tell me if you can hyperextend all the way in the back. How's that?
That's as far as I can go.
Okay.
Yeah.
Go ahead and break back into position. And now we're going to rotate backwards. So go ahead and move it all the way back so that it can create a 90 degrees angle with your body if you can.
Okay.
Only if you can. Okay, good. And now go ahead and move your palm, your hand in the back, and try to touch the middle of your shoulder joints.
Like what do you mean? Sorry.
Like try to touch here in the middle. Okay. Any pain when I press down here?
A little.
Okay.
But it feels good too.
Okay. Alright. I'm gonna try to see if you have still full sensation in this part of your body. So what I'm gonna do is I'm going to do a sharp or dull test again. If you extend your palm, I'm going to show you what sharp will feel like.
That's sharp.
Okay. And then this will be dull. Okay. Go ahead and relax. And
Sharp. Sharp.
okay, so this is sharp, this will be dull.
Oh, the sharp is the punch.
Just one, and then this is dull.
Okay. I thought you were rolling.
No worries.
Okay. That's dull.
Okay.
Sharp. Dull. Sharp. Sharp. Dull. Sharp. 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 Dull. Sharp. Dull.
Okay, I'm moving down in the back to the scapula.
That's sharp. 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 Dull. Dull. Dull.
Okay. And now I'll be doing the same thing with the sensorial brush. Can you please just tell me, yeah, it'll feel like this, but just tell me where exactly you'll feel it
Sure.
to the best of your ability.
Sure. Down my shoulder. Down my upper arm. And my shoulder to the back. Shoulder and back at the same time. Down my back arm and back, but closer together. Right side of my back. One on my right shoulder. One on my right shoulder.
Okay. Looks good. I'm gonna go ahead and just check your reflexes one more time. Okay. So what I'm gonna do is I'm going to slowly palpate, slowly massage your joint. And it'll feel a little bit cold, but they're gonna warm up soon, okay? In just a few seconds after touching your body. Okay, let me know if you feel any kind of pain. I'm going to apply some kinesiology tape. This will definitely help to keep the joint together, and also it'll help with the inflammation and also with the healing process. It'll speed it up.
Cool.
Okay, so I'm going to start here first. And the last one will be in the back. Okay, how does it feel?
Feels like supported. It does. It's sturdier. Wow.
Okay. I'm gonna go ahead and just palpate your back as well.
Okay.
Okay. And can you look up for me, please? Take a deep breath in and hold it in for 1, 2, and 3. Good. And I'm gonna try to do the same thing on the other side. Okay. Go ahead and look up. Take a deep breath in. 1, 2, 3. Hold it. Good. And breathe out. Perfect. Okay. Wonderful, Katie. Everything looks very good. I was able to adjust your shoulders a little bit. You're gonna feel great. Give it about 24 hours and you're gonna notice the difference.
It already feels a lot more supported, and I feel like taller and heavier.
Perfect.
Okay.
All right. And do you have any questions for me?
Not for now, but you'll call with a follow-up.
Yes.
Okay.
Absolutely.
Awesome. Yeah.
All right. I'll see you back soon.
Great. Thank
Take
you
care
very
now.
much. Yep.
How are you?
I'm good. How are you doing today?
I'm good. Thanks. Thank you so much for coming in. I'm going to go ahead and do your examination today, but before we do that, can you please verify your date of birth and your first name?
Yep, it's going to be Caitlin, and November 5th, 1997.
Wonderful. Do you have any allergies, Caitlin?
I don't.
Okay. All right, so go ahead and explain a little bit what's going on, what's bothering you.
I was going to say my back has been bothering me a lot recently. I've been doing some more athletic type stuff, and it seems like it's really put a lot of pressure on it, and there's not really much I can do to relieve it.
Okay. Do you suffer from any medical conditions, any musculoskeletal problems?
I've been having a bit of insomnia recently, but it's also been related to this pain too.
Okay. And are you practicing any sports?
I've been doing some kickball with my friends recently, and we've been trying out baseball as well.
Okay. I'm going to go ahead and just do a quick examination of your nerves. I want to make sure that everything is, working within normal limits. And then I'm going to go ahead and examine your back. Does that sound okay?
That sounds good. Thank you.
So I'm going to first take your blood pressure. Is this arm good?
Yeah.
All right. Okay, go ahead and uncross your feet for me, please.
Okay.
blood pressure is normal, 110/75, which is good. So a quick examination of your nerves means that I will examine your vision, your hearing, smell, taste, and your facial sensations as well.
Okay.
So let's go ahead and start with your face. I'm going to perform a sharp or dull exam. Can you please extend your palm? All right. I just want to show you what sharp will feel like.
Okay.
And this is what dull is going to feel like. All right. So go ahead and close your eyes and tell me if you feel sharp or dull.
Okay. Dull. Dull. Sharp. 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 Dull. 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 Sharp. Sharp. Dull. 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 Sharp. 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 Dull. 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 Dull.
Excellent. All right, I'm going to check your taste. I'm going to put one drop of this on your tongue.
Okay.
Okay, go ahead and tell me what this tastes like.
Peppermint.
Okay, very good. And I'm going to check your smell. Go ahead and close your eyes, please. Take a deep breath in. Breathe out.
Eucalyptus.
Okay, very good. All right, I'm going to go ahead and check your hearing now. Have you noticed anything abnormal with that?
No.
Okay. I'm going to whisper some words in your ears, and I need you to repeat them back to me.
Okay.
Go ahead and cover your right ear for me.
Okay. 1993.
Good. And now go ahead and cover your other ear. 1881.
1881.
Good. Okay. And now I need you to cover one eye. And with your other hand, go ahead and hold this card.
Okay.
I'm gonna have you extend it all the way. Perfect. Can you please tell me what color this is?
Red.
And what color is this?
Green.
Good. Can you please read the last row, starting with the first letter?
L T F P H.
Good. All right, go ahead and switch eyes. Good. Can you please tell me what number this is?
2.
And what number is this?
9.
Good. Can you please tell me what color you see?
Red.
Good. And now read the last row, starting with the first letter to the right.
H P F T L.
Okay, very good. All right, so everything looks very good. No concerns there. What I'm going to do now is I'll have you face to wall, and I will examine your lower back.
Okay.
Okay, I'm going to go ahead and gently palpate. So I'm just starting with the cervical spine and moving down to the thoracic. I'm feeling for any warmth, any signs of inflammation, anything swollen around the spine.
no deviation of the spine to the left or the right. So no kyphosis, no scoliosis. It's good. And moving down to the lumbar area. I'm going to have you lean a little bit forward, and there you go. And try to touch your chest with your chin. This way we're looking at the accentuated spine and just seeing how the curves are behaving. It accentuates everything, if that would be a problem. And this is just a second step to make sure that we're not missing anything. Good. You can come back. Perfect. I'm just checking your scapula here. Good. I'm going to take some measurements of your whole back. I want to see if right and left are symmetric, and if I'm noticing any deviations of the angles and any deformities of how your muscles are behaving. Just measuring the angles of the base of your shoulder blades. 10 more lines. 9.3. Okay, so it looks pretty symmetric. I'm gonna go ahead and tap on the bony prominences of your back. Let me know if you feel any kind of pain.
Okay.
Now I'm going to make some vibrations with a tuning fork, and I'm going to ask you to tell me when you don't feel the vibration anymore.
Okay.
Okay, do you feel this?
Yeah.
All right, go ahead and tell me when you don't feel it anymore.
No.
Good. Do you feel this?
Yeah.
Tell me when you don't feel it.
No.
Good.
No. 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 No.
So I'm going to go ahead and do a sensitivity test on your back.
Okay.
I will touch you with a soft object. This is what soft is going to feel like. And a sharp texture. This is sharp.
Okay.
So go ahead and close your eyes and tell me if you feel soft or sharp. Soft. Sharp. Soft. Sharp. Sharp. Soft. Soft. Sharp. Soft. Sharp. 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 Soft. Soft. Sharp. 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 Soft. Soft. Sharp. Soft. Sharp. 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 Soft. Sharp. Soft. 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 Sharp. Sharp. Soft. Soft. And now I'm going to go ahead and introduce new textures.
Okay.
Can you please tell me if you feel right or left?
Left. Right. Left. 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 Right. Left.
Okay. And can you please tell me where you feel this?
Left. Right. Left. Right. Left. Left. Right. Right. Left. 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 Right. Left. left, right, left, right, right.
Okay, very good. I'm going to work on your spine, increase blood flow to the thoracic area, and make sure that we go all the way down to the lumbar where your pain is located. Activating pressure points that are in charge of lymphatic drainage, and this will help with pain relief. I'm going to apply some pressure, and let me know if you feel too much pressure. I definitely want to just work on the ligaments that are controlling your thoracic spine. going to apply kinesiology tape on both sides of your lumbar spine. And I usually suggest to keep it for about a week if it lasts. You can take a shower with it and just pat it dry with a towel. Let's go ahead and just adjust them. Okay, this is going to help with alleviating pain, releasing anti-inflammatory molecules into the muscles, and just alleviating any inflammation that is going on right now. I'm also going to check your scalp. Sometimes there could be seen patches of redness and dryness. If that is the case, then it could really explain some of the inflammation that is causing your back pain. And for that reason, we could definitely treat it with proper blood flow to the area, increase oxygenation, and stimulate toxin release. I'm just going to go ahead and use my light here and just look at the scalp.
I'm definitely noticing some redness behind your ear and just a few dry patches throughout the right side of your scalp, but nothing too concerning. So this should be a pretty easy treatment, and probably you don't have to repeat it. It's okay for us to do only a one-time treatment to the scalp, and we're going to increase blood flow. So I'm going to go ahead and perform hair pulling. It helps to stimulate the hair follicles and all the body parts of the skull. Hi, Katie.
Hi.
How are you doing?
Good. It's good to see you again.
Good to see you too. So I see here that you're in for a back exam.
Yeah.
Okay, what happened?
So I moved a couple months ago, and I was lifting a lot of things that day, and like ever since that day, it's just been like some constant pain on both sides of my back.
Okay.
Yeah.
Okay, so both sides.
Yeah.
And where was it exactly? Here. Okay.
Yeah.
And on the other side, sorry.
Yeah.
Okay. Okay, so I'm definitely going to give you a very thorough exam today. And let's see. Do you have any new allergies?
No.
Okay. And on a scale of 0 to 10, how would you rate your pain right now?
I would say it's about like a 6.5, but usually it's a 7.
Okay. And are you taking any medicine that helps with the pain?
No.
Okay. And are you able to carry your daily activities?
For the most part, everything except for like groceries, like carrying things like a jug of milk hurts.
Okay. So are you able to feed yourself, take a bath by yourself, and get dressed by yourself?
Yeah.
Okay, that's good. Okay. And did you try anything to relieve the pain, like some stretches, yoga, chiropractor?
Yeah, bath. Bath really helps. And then yoga as well, a couple times.
Okay. And you mentioned you've been having this pain for a few months.
Yeah.
So let's go ahead and see you today.
Okay.
Okay. I'm going to go ahead and sanitize my hands.
Thank you.
Okay, it's wonderful to have you back.
Yeah. You too.
Great. Have you had any flu-like symptoms in the last 2 weeks?
No.
Okay. I'm going to put this on your forehead to check your temperature. Okay, great. So your temperature is 98.3, which is normal. And I'm going to put this on your finger. It measures your oxygenation level. Okay, so just relax for me, please. Take a deep breath in. Okay, so your heart rate is 74 beats per minute, and your oxygenation is 99%. I'm going to put some gloves on. So is it okay if I put your hair back? Yes. I'm going to listen to your heart and your lungs in the front. Okay, so just relax for me, please. You can breathe normal. Okay, good. Okay. Okay. So I was able to hear only S1 and S2. No S3, no S4. That's very normal, and I'm not detecting any murmurs. I'm going to listen to your lungs now, so please take a deep breath in and exhale. Very good. Can you do that one more time? Take a deep breath in and exhale. Okay, excellent. And what I'm gonna do is I'm gonna have you lay down on your back. I'm first going to go ahead and examine your chest and your abdomen, and then I'm gonna have you move and we're going to examine your back. Okay. Okay, great. Go ahead, lay down. Okay, Katie. So what I'm gonna do now is I'm going to very slowly tap on your chest and your abdominal area. Let me know if you feel any kind of pain. listen to your abdomen. Is it okay if I lift the shirt up a little bit?
Yes.
Okay. Okay, so very normal abdominal sounds. Okay. I'm going to slowly palpate your abdomen. Okay. So I'm not noticing any abnormalities. That's good. Okay. So what I'm gonna have you do now is I'm gonna have you take off your shirt if that's okay.
Yeah.
Okay. And I'm going to examine your back.
Okay. Sounds good.
Okay. Great. Okay, so I'm looking for symmetry, and I'm just going to slowly palpate. I'm gonna need you to relax. Take a deep breath in and exhale. Good. Take a deep breath in and exhale. Good. Okay. Can you please tell me where you feel this?
My right shoulder. Left shoulder. Middle of my back. Lower back. Right shoulder. Left shoulder blade.
Okay. Can you please tell me if it's sharp or dull?
Sharp. Dull. Sharp. Dull. Sharp. Dull.
Okay.
Dull.
I'm going to apply some pressure. Let me know if it hurts.
That feels good.
Okay. I'm going to push down on your scapula. Take a deep breath in. Good. And I'm going to do the same thing with the other side. Take a deep breath in. And exhale. Good. Turn this way for me, please. Good. Relax. And this is going to feel a little bit cold. I'm gonna try to warm it up for you. It's going to feel like a massage.
Good.
I believe I finished the back exam, so I'm gonna have you get dressed and we're going to discuss further results, okay?
Sounds good. Thank you.
You're welcome. Okay, Katie, I believe I did some adjustments on your back.
Yeah.
And you should start feeling better within a few hours for sure.
I felt amazing. Yeah.
I'm glad. Okay, I'm gonna go ahead and write down some notes so I was able to notice any scars, no skin changes, and also no obvious deformities. Your spine is very aligned, so that's good. Okay, do you have any questions for me?
It's already starting to feel better. So
I'm glad.
That's good.
Okay, thank you so much for allowing me to do this back exam on you, and I'll see you back soon.
See you soon.
Yeah.